joining us today. I am Melissa Silva, the Executive Director for Mental Health Association for Greater Baton Rouge, the Louisiana affiliate for Mental Health of America. MHA has served the Baton Rouge area for over 66 years. We are partnering today with the Louisiana Department of Health, the Office of Behavioral Health, to offer this 911 event. These events offer education and topics affecting all of us in our state. As an advocate organization for those with behavioral health needs, today we bring you experts in the field speaking on topics that are relevant to your area. While we cannot be face-to-face today to have these conversations, we feel the need to continue. There will be time for questions and answers from our panel at the end of the discussion. Please enter your questions in the Q&A section, and that is separate from the chat box. We will address as many questions as time allows. Through a partnership with Imperial Calcasieu Human Services Authority, we are proud to present Supporting Essential Workers' Mental Health. We are now a year into this pandemic, and in the case of this area served by Imperial Calcasieu, specifically much national disaster, the topic is not only timely, but one of need. Our essential workers are on the front lines, and we see this as a critical time to offer to support those who have always taken care of others. We would like to thank today's speakers for giving of their time and expertise. Please enjoy this presentation.
Hi, my name is Tanya McGee, and I'm the Executive Director for Imperial Calcasieu Human Services Authority. And I just wanted to take a minute to say thank you. Thank you for taking an hour and a half out of your day today to participate in this seminar. We have had some interesting things happening to us in this last year with the COVID pandemic, but even so much more in Southwest Louisiana with our two hurricanes that were 7 weeks and 13 miles apart. Nobody else in the country and in the world has gone through the devastation that we have gone through in this last year. And if you, like myself, as a public servant, you do what I do, which is to make sure that your community is taken care of, to make sure that people in your community are healthy and they're safe and they have the services that they need. And you usually do that before you take care of yourself. So I'm very happy that for the next hour and a half, you're going to be selfish and you're going to take this time for yourself to ensure that you're okay. Because as an essential worker, you have to be okay. We have to be okay to continue to provide the services that we do for our community. So from the bottom of my heart and from Imperial Calcasieu, thank you for participating today.
Hello, everyone, and thank you so much for being here today and for having me here today. My name is Sherrod Crespo, and I am on the clinical staff in the position of Outreach and Traumatic Loss Coordinator for VIA-LINK. For those of you that are unfamiliar with VIA-LINK, we are a local area nonprofit, and probably what we are best known for, our widest cast net in the state, is our 24-hour call center, in which we answer 24-hour available crisis intervention, suicide intervention, as well as information and referral, phone, chat, and text lines. And I will give y'all some more information about those at the end of the presentation. But today, we are here to talk about you, about the essential worker, the superheroes that have been even extra super during this past year of 2020 and 2021. But we're here to talk about that you are superheroes, but you are not superhuman. You know, we are still susceptible to the stressors and the anxiety and the what can seem like chaos that has been going on at all times through our position as caregivers, but especially within the past year, and that we can't be superhuman. We are not immune from stress. We are not immune from feeling overwhelmed or even being in a state of crisis. So I'm here today to talk about the importance of knowing your limits, setting boundaries, and identifying burnout and how you might be getting into a crisis state. So I'm going to go through talking about the development and how we actually get into this crisis state, the state of being completely overwhelmed. I'm going to talk a little bit about what's actually going on behind the scenes, what's going on in the brain when we're in a crisis state, the importance of self-care and how deliberate self-care can prevent us and also get us out of a crisis state, reaching out for help, and then resources that you can utilize for yourself and also for your clients. So working during disaster, and we've been working during disaster for a year now. We just reached the 1 year anniversary of the stay-at-home order from 2020. And in that time, we also had a record number of natural disasters, and from hurricanes to ice storms to all of it. It's been a crazy year. And for essential workers, this has been a really unique call that we've had to help others through disasters that you're often being affected by yourself. And this can lead to compound trauma. You've got vicarious trauma from those that you've helped, those that you're helping, those that you're expending your empathy and emotional energy on. Then you've also got your own trauma and stress from enduring the disaster and its unique stressors. We've got constant absorption of stress through work and then through media and social media. We're also continuing to work and help others with extended hours and compiled stress. So, I want to talk about how we can actually get ourselves into what we call a crisis state. A crisis state being when we are completely overwhelmed and our brain waves, our brain chemistry, our brain energy literally changes to where we get this kind of cognitive constriction, and our brain is not sending out energy and electricity into our more complex thinking parts. We are really just focused on this perceived threat, this crisis state that we're in. So, to go over crisis theory in a nutshell, a crisis is self defined. There's no metric of what type of event is so big enough or significant enough that it would put you into a crisis state. It might actually be something quite small that triggers you into actually going into a full on crisis state. Because to get into a crisis state, it's not necessarily about what happens to you, it's about when it happens. Something that pushes you over the edge into a crisis state might not have previously and may not in the future, because it's not about the impact of the actual event, it's about when this event happened to you. So, what I mean by that is that we have a buildup of stressors over time, good and bad stressors. That is how all of us live our daily lives, good and bad stressors that are affecting us. Good stressors are things like maybe you got a promotion at work, but that comes with added responsibilities, maybe having to get to know new work colleagues, extended hours, etc. A good stressor, but it is a stressor. Maybe you got a new pet, but that's an added financial responsibility and time responsibility. Maybe it's your birthday and you're trying to figure out what to do. Good things that they do cause stress and emotion in our lives. And then bad stressors, things we typically think of with stress, financial issues, um, issues at work, interpersonal conflict, illness, anything like that, these negative stressors. But that is how we live, with things affecting us, good and bad, that cause stress and emotion in our brains. When we're working towards a crisis state, we are experiencing our stressors, except for we're not applying coping mechanisms. When we're operating functionally, we experience stressors in our day. Our brain kind of identifies what emotion is being caused by this stress: happiness, anxiety, fear, depression. And either consciously or subconsciously, we apply a coping mechanism. So you're having a lot of stress at work, a lot of new cases, a lot of new clients. So okay, I have to end work early on this Friday and I'm taking a little vacation. Or I know at the end of the day, I need to go exercise to relieve this anxiety. Maybe you've had a loss in your life and you're feeling sad. So okay, I know I need to get home, put on my comfy PJs and binge out on Netflix. You're identifying an emotion for your stressors and you're coping and relaxing through it. As we're building to a crisis state, our stressors keep building either as normal or maybe at a more escalated rate. Maybe you're having more stressors affecting you, but we stop coping through them. We stop identifying our emotions because maybe we just feel like we don't have time, and we stop applying adaptive coping mechanisms for these emotions. So work stress is building, but you're no longer exercising. Maybe you had a fight with a friend and you're feeling anxious about it, so you don't get enough sleep. You're eating junk food instead of eating healthy food. You're not decompressing at the end of the day by venting to a friend or your significant other or a family member. So your stressors are building and your coping is dropping. And basically, what happens is what we call the precipitating event. And that's whatever that next stressor is, where your stressors eclipse your coping. You have no more coping left. You have no more chill. This triggers you into a crisis state. That event could be small, like losing your car keys, or something big, like a death. Whatever it is, it just means that you have no more ability to cope. Your brain can no longer identify what emotion you're having and help you apply a coping mechanism. You enter into what's called a crisis state. and your brain is affected. The electric signals get shut down, and you are operating purely from your fight or flight response. Now, this is time limited that you will be in this overwhelmed state. You can only be in a crisis state for about 2 to 5 days, kind of depending upon your brain makeup. One way or another, you're going to exit this crisis state. So, what you want is to get connected to your adaptive coping, adaptive restorative coping to help with the emotions that you've been experienced and restore strength in your brain. Because if you don't get connected to adaptive restorative coping, you're going to utilize maladaptive coping. Maladaptive coping being things like not getting enough sleep, eating junk food, maybe hanging out with people that aren't as beneficial to your mental health, and then even more severe maladaptive coping like substance use, self harm, and for someone with suicide ideation, maybe even a suicide attempt. This is a visual of that crisis state, the development with your stressors building and your coping dropping. Your precipitating event puts you into this crisis state, and one way or another, you're coming out of it with some spectrum of coping. Now, if you're connected to adaptive restorative coping, it rebuilds that resiliency in your brain and helps you not re enter a crisis state. Maladaptive coping is going to keep affecting your brain in a negative way with stressors. You're not building up resiliency, and it's more likely you will re enter a crisis state the next time your stressors build. So, you hear me talking about that your brain is going into this fight or flight response. And you may be wondering, like, why would we enter into a fight or flight response because we're stressed when there's not, an actual danger to our life? So I want to talk a little bit about how that happens by first explaining the sympathetic nervous system versus the parasympathetic nervous system in our brain. So the sympathetic nervous system is the body's fight or flight response. That's the part of your brain where you shut down, you've just got this cognitive constriction, this tunnel vision. The brain is not sending electricity to like the prefrontal cortex or our higher thinking parts of the brain. The other part of our brain is the parasympathetic nervous system. That's how we are in our daily lives, where all of our brain is getting electricity. The parasympathetic nervous system is responsible for sleep, digestion, language skills, understanding repercussions and decision making, and other activities when the body is at rest and when we feel safe. When one system is active, the other is not. Remember that sympathetic nervous system kind of activates where it's like we don't have time for anything else because we have to keep ourselves alive. When the parasympathetic nervous system is active, we're happy and comfortable and satisfied. But when we perceive a threat, our sympathetic nervous system is activated and we enter into that fight or flight mode, and the rest of the brain is not getting electricity. So, how the sympathetic nervous system activates when we actually don't have a physical threat to our body is when we're living in a constant state of stress and anxiety and we are not coping with the stress or anxiety. Living in this constant state of anxiety or stress can atrophy or diminish volume and activity in what's called your anterior cingulate cortex. So, the anterior cingulate cortex is partly responsible for how we filter our reality and process whether we are safe. When it's happy and it's functioning, it bases threats to our lives upon our sensory information. I see a bear coming towards me. I smell smoke. I hear an alarm. I taste something poisonous. I feel something burning. That's how it will trigger that we need to activate our sympathetic nervous system to save our lives. With constant stress and without restorative coping, the volume of our anterior cingulate cortex will shrink and electrical activity will diminish when the stress hormones cross the blood brain barrier and we're not restoring that with relaxation at the end of the day. When this diminution functioning occurs, individuals are going to stop making decisions based upon that sensory information, and we're going to make them based upon learned information or past experiences. Those compounding stresses will activate this fight or flight response. So we'll perceive a threat. Our brain will operate like there's a threat and stop electrical activity even when there isn't one. And that's how the fight or flight response activates, even though we're not in actual physical danger. So humans have evolved to where we can be in a prolonged state of sympathetic nervous system dominance. By design, of course, this was meant to only be used in spurts to actually get you out of the danger or fight your way through the danger when there was an actual threat to shut down other operations of the brain and put all the functioning in on survival. But because of our capacity for learning, we can now operate under a feeling of a chronic perceived threat. And that's because we are perceiving threats based upon our learned experiences rather than sensory information. So when working with constant stress and anxiety, you can stay in a constant state of a perceived threat or sympathetic nervous system dominance. And that then causes us to focus solely on our perceived threat, which is our stressors, which are present outside of the mind or body. And we're focused on the external. And our brain is not focusing on the internal and self regulation like we would when we're applying coping mechanisms to our stressors. Also, with media consumption, we live in an age with less of a chance of immediate threat or danger than there has been in human history. But we as humans across the board have higher rates of fear and anxiety. And many studies believe this is caused by constant media and social media consumption. Though we live with less threats of danger than our ancestors, we are constantly exposed to violence, conflict, danger, death through the media. And due to this repeated viewing, we can be traumatizing ourselves by witnessing traumatic situations at exponential rates in comparison to our ancestors. Then, with increased social media, more stress can be caused due to conflicting stories, false information, overexposure, and increased exposure to interpersonal conflict as a result to the event. So, with media, with social media, and then with your stressful jobs, and then the chaos of the world around us, if we are not relaxing, if we're not restoring that energy to our brains, we will enter into a crisis state. So, what can we do? Relaxation. When we talk about self care, it is important because it's literally what's going to keep your brain functioning and oxygenating and getting electricity sent to it. Intentional and deliberate self care is more important now than ever. Relaxation and breathing will undo the atrophy in the anterior cingulate cortex, keep it happy and functioning so that you do not enter a crisis state. You can't problem solve until a state of relaxation has occurred. You can't fix the next day's issues. You can't fix your interpersonal problems until you get that brain firing and operating correctly. Mindfulness and introspection to identify what emotions are being caused through work, school, personal stress, etc. is so important. You've got to have the power to name the emotion that you're feeling deliberately and then decide what coping mechanism is going to help you through it. Remember that all emotions are good. There's kind of this misconception out there that like happiness is a good emotion and anger and sadness are bad. But all emotions are good and they are natural and they are automatic. They are how our brain is processing the data we're inputting into it. Our power is in how we relax and cope through our emotions. I like to say emotions are like matter, they cannot be destroyed. If you push them down, they're going to bubble up and explode. We want to experience emotion as it occurs so that we can process through and cope through it in an adaptive way. Purposefully name that emotion that you're feeling at the end of the day and decide what coping mechanism, what relaxation mechanism is going to help you process through it. Make that time for self care and know what works for you in specific situations. Self care. That's the coping that will keep you out of this crisis state. Doing things like reducing your media consumption and social media consumption, knowing when you've had enough, limiting screen time and getting outside. Knowing how to leave your work at work. Work is a constant stress for the superheroes right now. And this is a responsibility of employees and of the employers. Making sure that you have time that when you're at home, you're not getting emails, you're not getting phone calls, you're concentrating truly on yourself. Doing things like, especially if you're working at home, having a work area and then leaving it when the work day is done. Symbolically and physically leaving the workday, making sure you change your clothes, go do another activity, cook dinner, take a walk, do something that really represents the transition of the day from work into you time. Being sure to deliberately name your emotions and decide upon coping mechanisms for them. And I cannot stress how important it is to get outside. Going outside and mindfully concentrating on your sensory information, grounding exercises, naming 5 things you can see, 4 things you can hear, 3 things you can smell, things like that. Activating your senses to undo that atrophy in the anterior cingulate cortex and breathing, literally oxygenating your brain. That can put your body in a state of rest and can return your neocortical functioning. Ask for help. There is help and support out there to address the stress, the burnout, and even if you're experiencing suicide ideation. And know that stress will end, but that doesn't mean it won't come back or that the effects of the trauma will never return. There's an importance in long term support and care for yourself. And to remember that we are superheroes. You, the essential workers, are superheroes, but you are not superhuman. You've got to know your limits and accept when stress is affecting you. Remember that you're going through the pandemic, you've gone through the natural disasters too, and you have the right to be supported. Without gaining access to help and care and support, trauma or even suicide ideation can grow more intense and your risk level can escalate. It is okay for you to not be okay. We are like everyone else. Sometimes we get overwhelmed. Let's not only ask for help when we need it, but help our fellow superheroes get connected to support when we can see them struggling. And to remember that you can feel better. We have a responsibility to each other. As essential workers, we're in a unique experience together, and it is our job to take care of each other. If you notice a change in a coworker, a friend, or a relative, ask how they're doing and help them get connected to care. Let's reduce the stigma of needing help, of not being okay. That is part of being human. The pain, the exhaustion, and the trauma of being an essential worker during times of disaster is real, and we must make this okay to talk about and to take care of each other and keep each other accountable. You can also utilize our resources at VLink for yourself, for your coworkers, for your clients. We have 24 hours, 7 days a week available helplines. They're available during disaster, during holidays, you name it. We are there. They are confidential. All of our employees on our crisis lines are trained in emotional support, crisis intervention, suicide risk assessment, violence risk assessment, emergency room diversion, active rescue, and they are all mandated reporters for child abuse, adult with disability abuse, and elderly abuse. Some of our lines include the Keeping Calm line, which was launched in result of the pandemic and then the natural disasters. That's available by calling 866-310-7977. We also answer the National Suicide Prevention Lifeline. That's 1-800-273-TALK. We have a statewide available crisis team text line. That's available by texting 833-TEXT-TEEN. We also have Louisiana Parent Line, which is a statewide emotional support line for parents, available by dialing 833-LA-CHILD or texting 225-424-1533. And we also have crisis chat available through our website at vialink.org. Some of our other services include training and education on suicide, suicide risk assessment, or crisis intervention. For more information about that, you can email me at screspo@vialink.org. We also do offer a statewide weekly virtual adult survivors of suicide loss support group. For more information about that, you can email sos@vialink.org. And please explore our services on our website, www.vialink.org. We want to be a support to you and to the community as much as we can. Again, thank you so much for all that you do, all that you've been doing in the past year. You are truly superhumans, and thank you so much for having me here today.
Good afternoon, everyone, and welcome to this session. I am so excited. My name is Dr. Jeremy Blunt, and today we have an awesome presentation in store for you. It is entitled Understanding and Preventing Provider Burnout. I'm so excited about being part of this Behavioral Health 911, specifically for our essential workers. This whole presentation has been designed and targeted specifically for you. Why? Because I feel it's important to take a time out so you don't throw in the towel. Again, my name is Dr. Jeremy Blunt. I'm the president and CEO of Stitches for Life Incorporated. And today I'm excited to present this to you. A little bit about myself. I am a faith-based therapist here in Baton Rouge, Louisiana. I specialize in crisis prevention, cognitive behavior therapy, and empowerment training and motivational training. I have over 20 years of management experience teaching. I'm a motivational speaker and entrepreneur and an author. I'm often referred to as the Stitch Doctor. So today, just to give you a little overview of what we're going to discuss, we're going to talk about, I use this system called IR2S, and it stands for Identify, Recognize, Respond, and Sustain. We're going to identify. We'll begin with that. Understanding what burnout is, who's at risk to it, how to know whether or not you are. And then we'll talk about recognize. First R stands for recognize. You cannot recognize anything you cannot identify. Where does burnout come from? What does it look like? Then we'll talk about responding. Now there's a difference between responding and reacting. and we'll talk about the difference between them. We'll talk about how to reframe how you view burnout. And then we'll talk about sustainment. Because even though you may be able to identify, recognize it, and even respond right, then you have to be able to handle that long term. And I know that this time between the hurricanes we experienced during 2020 and COVID, this has been a trying time for a lot of people. So this is going to be an awesome opportunity. If you have questions, something that I bring up during the talk, by all means, please stick around. We're going to have a Q&A. I'm going to answer some common questions, but I'm also going to open up the floor at the end to answer any questions that you may have regarding provider burnout. So let's dive in. First off, what is burnout exactly? By definition, you'll see it there. I have it. It is a state of emotional, physical, and mental exhaustion caused by excessive and prolonged stress. It occurs when you feel overwhelmed, emotionally drained, and unable to meet constant demands. Look, I know as a result of some of the things that your regular job, having to get up every day and do things and take on tasks, and it seems like things have just been relentless, that all you could do is keep your head down and just go, 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 go. And you don't even realize the effect that it's having on you. As a mental health professional myself, I've often posed the question to other professionals of none of us really knowing even the effects or the aftermath of how this is going to affect us in the long run, people's mental state during this time frame, their ability, their socialization from having to be quarantined or isolated from everyone, then opening up everything and trying to get back started again, this whole process. So know that you're not in this by yourself. And burnout is something that is very real. So what does burnout really look like? I call it the fall. I call it the fall. It's described as, you stuck to the wall. Our face is crushed up against it. We've been spending the last couple months hitting it. Nevertheless, we managed to hit it again. We get up, we go out there again, harder this time. And it's almost like we're propelled to do it, propelled against it. It's like you're constantly doing it over and over and over again to the point where you can't remember when yesterday was and when today started. All you know is you just get up, and it's almost like a zombie type feel where you get up, you go through the motions. You shut down to get up, go through the motions again. The fall is not necessarily the lowest we get, but it's actually the very start. The very moment when your body fails, when you fully acknowledge that we are in trouble, and that for the first time, there is no way that we can deny it. That's when we call it the fall. It's that moment when other people are telling you, hey, you need to take a break. You might need to back off a little bit. You might need to do something different. And it seems like you're listening, but you're not really listening. You're just going through the motion of things. It's those moments. That's when the fall happens. It's when you're not prepared. You're not looking forward, but you have to make these on-the-spot adjustments as you go along. So I want you to just examine yourself for a moment and ask yourself, okay, have I fallen in this category? Now, if you're not really sure still, let me give you some telltales if you are experiencing burnout. Have you become cynical or critical at work, just extra, about every little small thing? Do you drag yourself to work or have trouble getting through the things that you would normally be doing? Does this sound like you? Have you become irritable or impatient with coworkers, customers, or clients? You hear yourself, even with your family. Have you become short with them? You have patience for everybody else. But when it comes to your family, you're ready to jump at it. Things, have you noticed some shifts in your mood? If you haven't noticed, have other people complained about it? Have other people said something about it? Do you lack the energy to consistently be productive? You set out to do stuff and it seems like you can't get it done? Do you lack satisfaction from your achievement? Do you get to the point where it just seems like you wonder why you're still doing the things that you're doing? Or what about this? Do you feel disillusioned about your job? Like the whole facade of what it meant to you doesn't mean the same anymore. You wonder why you still do it. Are you using food, drugs, or alcohol to feel a little bit better, or to deal with it, to face it, to come to grips, just to try to feel a little bit better? Have your sleep habits or even your appetite changed? Are you troubled by unexplained headaches, backaches, or other physical complaints? If any of these questions ring true to you, you may be experiencing burnout. Well, these are some of the other common symptoms. Emotionally and physically, you may be experiencing things like shock or denial, confusion. You may be, like I said, overly irritable, or I might have mood swings. You have this extra fear, guilt, shame, withdrawing from others, feeling sad or hopeless, and you just can't seem to shake it. You feel disconnected and numb. Those are the emotional symptoms. But there are also the physical ones. Things such as having nightmares or insomnia, not being able to go to sleep, feeling extra tired, being startled easily, difficulty concentrating, the list goes on, aches and pains. You ask yourself, have I been experiencing these? If you've been experiencing at least 2 to 3 of these, you've been dealing with burnout. So please pay close attention to this. Or if you haven't seen it in you, have you seen it in coworkers? Have you seen it in loved ones? Now, here's what we typically do. And I'm gonna shift into recognizing. Now, you've recognized it. Now let's talk about responding. Now there's a difference between responding and reacting. As you can see, reacting is acting as a result of things that have happened. Responding is acting by taking a particular course of action. Easiest way to explain this is simply by saying, when you dial 911, ironically, who we're talking to today, they call you emergency responders, not reactors. And if anybody, I know I've seen, well, I've been around and they've called 911, and it's always funny how emergency workers show up and they're very strategic. They get out, and it always seems like if you are in a crisis in that moment, you feel like they're moving in slow motion. They make sure they got their bags, they make sure they bring the stretcher, they make sure, and even when they get there, they're going through these steps to check things. That's because they've been trained to do that. There was a plan that was put together before they ever came to an emergency. And instead of them coming to the emergency, they bring the plan to the emergency. They come, but they bring the plan that they rehearsed to it. So in order to properly deal with burnout, to deal with some of these challenges, now none of us knew COVID was going to be what it has been. So it's not anybody's fault. And how we've been balancing it the best way that we knew how to balance it. But it's also our job now to put together a plan. Okay, now that I know that things are like this, let me prepare for that. Even if it's some things, I live by a schedule. I make sure lunch is prepared prior to. I pull out my clothes prior to. I put in my schedule some other things to make sure I'm bringing that plan to what is going on. So here's some things of how you can respond to burnout. 1, prioritize your life, not just your day. Prioritize your life, not just that day. All right, where we going? What we doing? It means, hey, I need to take a time out. Let me pause for a moment. Let me get my balance. Let me reconfigure how things are going to go to determine where I go next, what I'm going to do, and how I'm going to do it. This is how you bring a plan to burnout. It's about being preventive. It's about putting things into place so you're not trying to play catch up. You're already there. Then pay attention to your body, thoughts, and experiences. Just take a moment and pay attention. Does your body feel, or are you overly tired? You've gone to bed for 8 hours and you wake up just like you hadn't gone to sleep? What about your thoughts? Are you having thoughts of wondering what you're doing and if what you're doing is doing anything? I always call it this. You have a responsibility to refill your cup. That means everyone else should be, if you had a coffee cup, underneath a coffee cup, there's a saucer. And if you were to pour into that cup, when it gets to the brim, then it overflows to the saucer. What we give to everyone else is our overflow. That means you have to constantly be pouring into you. What are you listening to? What are you putting into your body so that you have extra to give to everybody else? Burnout occurs when we stop pouring into ourselves, taking care of us, and then we stop giving from our saucer and we start giving from us. And you start feeling it when all of a sudden it doesn't seem like you have the energy to motivate yourself. It seems like you don't have the push to drive yourself. That is where that comes from. It's because you're not pouring into you. It is essential that you take care of you. Don't ignore your feelings. It will only slow recovery. Look, this whole saying, well, I'm gonna just get over it. You know, things will pass. I just gotta hang in there a little bit longer. Hold on, take a time out. Because if you get to the point where you don't have anything left, here's what you're gonna do. You're gonna throw in the towel. And then you're gonna not care about anything or anybody anymore. Let's not get to that place. In order to do that, you have to start paying attention to you. If you're feeling some kind of way, talk about it. If you hear one of your coworkers start talking about how things are making them feel, that is the time. Pay attention to the flags as they are there. And here's another one. Clearly define standards and expectations. Clearly define them. Determine exactly what it is that needs to be done and what's the expectation to get it done. Write them out. Don't just think them up in your head. Write them out. What is it that I need to do today? Okay, I got to do this. I got to do this. I got to do this. Well, I need to do these things. Okay, am I expected to do this, or is this something I would just like to do? So that at the end of every day, I make to-do lists. So that at the end of the day, I can look back and say, okay, what are the things that I've completed, I've done, that I set out to do that day? So I don't feel like yesterday looks like today, and then I'm not looking forward to tomorrow. Evaluate your options. Constantly look, okay, what options do I have? What do I absolutely have to do? I don't want to feel like I'm forced to do things or doing things unnecessarily. Adjust your attitude. Okay, that means I got to check my attitude. You can't adjust anything that you hadn't checked. Okay, how are people saying that I talked to them? Are your coworkers saying that you've been kind of short with them? Are your kids not, or is your spouse not wanting to talk to you as much? Is it that you feel like you get home and you don't have energy for nobody or nothing anymore? And you're snapping at people? Do you have road rage? Let's pay attention. All of these are signs. Hey, there's something going on the inside. Reestablish routine, as I talked about before. What did you used to do? Because see, exercise and sleep are essential. They are essential. Look, even if it means walking for 30 minutes every day, 30 minutes of exercise. I make a point. I put it on the schedule the same way I would schedule anything else. I schedule out. I schedule my time that I'm going to sleep. I schedule my time that I'm exercising. I put it on there, and you know what? I don't deviate. Look, I got this come up. I got that come up. I know, but this is a priority too. If you don't put you first, then your body will force you to turn around and not be able to do other things and only be able to do that. So this is why that is essential. Reestablish those things. Look, when you're experiencing this, put major life decisions on hold. Don't make, I tell people often, don't make these rough decisions when you're going through this period. This is the equivalence of trauma. You've experienced it. I know your workers and your job is to help other people. But at the same time, if you're not taking care of you, if you start experiencing burnout from helping others, then you have to reevaluate things and be careful not to cut things off, make major right decisions during that time frame. Those decisions will still be there. Look, I got to gather myself. I got to get myself together. Then we'll come back and we'll readdress and we'll readjust and then we'll move forward. Don't make those type of decisions. When you are ready, talk to someone. I can't reiterate this enough. Talking to someone helps. That's what I do. This is my plug for therapists. For those that may feel like, there's a stigmatism out there about what is talking to somebody going to, how is it going to help? It actually helps a whole lot. If you ever read the book, Men Are From Mars, Women Are From Venus, they talk about females are being, you all are verbal processors, outward verbal processors, where you talk by process, you process by talking to others. So when you get to a place where you're not talking anymore, that causes problems. Men, we're internal processors. We're going to process it inside, then we just want to present the solution. But you know what? Both of us need to be able to talk to someone. If it's someone that you know that's experiencing burnout, don't rush them to talk, but just say, hey, when you're ready, I'm here. I'm willing to listen. I don't want to necessarily give you all the answers, but sometimes I just need to let you hear yourself walk through the process of processing it out. So when you are ready, know that it's important. So really quickly, I'm gonna give you a couple tips about avoiding burnout. Here's number one, work and intentional playing. As we talk about it, manage your stress, revisit and reevaluate your goals and your routines. I like the way former First Lady Michelle Obama said it. We're not getting back on track, but we're creating a whole new track. We're not gonna go back to the things the way that they always were. Folks, it will never go back to the way things were before. But it's our responsibility to manage our stresses. You gotta be able to identify them. You gotta be able to recognize them. And then, okay, now I have to manage these things. This is how you sustain. Revisit and reevaluate your goals. That means from time to time, go back. Go back and look at those goals that you had. Where do you stand? What about routines? Where do I stand? I was supposed to work out 3 times this week. What happened? All right, look, what did I need to do? Do I need to put it in my schedule a different way? Do I need to say it a different way? Do I need to handle it a different way in order to make sure that these things happen? Okay, this didn't work. Maybe I need to try it this way. You don't give up on goals. You keep doing it until you find what works for you. Change is inevitable, but growth has to be intentional. Growth is intentional. In order for you to achieve those goals, you have to do it on purpose. I've never seen a successful person be successful on accident. It was always as a result of some intentionality. Okay. Number 2, annual self-audit. I had a friend that every year she would say, I sit back and I do an audit of my friends and those that I associate with, the impact that they have on me and the impact that I have on them. But then it took it a step further and I said, well, assess your own interests, skills, and your passion. The things that you may have been interested in prior to COVID, I call it the new BC, before COVID, may not be the things that you're interested in now. They might not be the things that interest you. It's okay, because as things change, seasons change, so do the things that give us that extra passion and that why of why we do. And then reevaluate your circle of influence. I believe our greatest superpower is our influence. Our ability, look, relationships is about everything that we do. Either we're influencing others or others are influencing us. Every now and then we need to stop and reevaluate the people that are in our circle or our realm of influence. Are you hanging around all negative people where all they talk about is how bad things are? They're not, don't like the job, don't like how much they're getting paid, don't understand why they're doing what they're doing. Well, if that's all you hang around, then that might be why those are some of the same things you started to say. You need to make sure you hang around some people that, hey, are going to give you some different views on life. Hey, well, this is the cutting edge thing that we're working on. This is what's next, the next step. Look, we're getting this extra money. I want to make sure we prioritize what we're going to do with it, where it's going to go. Reevaluate your influence. Your next one to sustain is simply keep moving. As I said earlier, exercise at least 30 minutes or more on most days, at least 30 minutes. Keep yourself moving. Mindful elements. This, instead of focusing on your thoughts, focus on how your body feels. Just go outside, take your shoes off, put your feet in the grass, and just feel the wind up against your body, the grass underneath your feet, and just take a moment and take it in. Breathe in the air, feel the moment, enjoy the moment. These are what's called mindful elements, because sometimes a simple shift in your focus from the thoughts that you have in your head to what your body is feeling can help direct you and tell you what's next for you. What do you need to change? What do you need to adjust in your life? Number 4, don't isolate, seek support. You don't have to talk about the issue. Sometimes, just talking to somebody. A lot of times when folks come and they sit on my couch, I allow them just to talk. I ask questions like, what do you want to talk about today? And I just allow them to talk. And eventually we'll get to the issue that is most stressing to them. But sometimes people just need to feel comfortable and they need to talk. You don't have to talk about the issue, but just talking starts to relax you and open up your mind and shift some things. Ask for support. Don't think you have to do this all by yourself. And know that other people other than essential healthcare workers also understands what it feels like. Don't feel like those are the only ones telling your family, you don't understand what I'm going through. You don't understand what it's like because you don't have those issues. Well, stress does not have labels. Trauma does not have specific labels. What was a crisis for one person may not be a crisis for another. And that works both ways in all the different elements. Employee assistance program. Look at your job, see what they may have that you can get involved in. Reconnect with friends that you may have lost connection with. Go and join a support group and maybe find new friends. Volunteer somewhere, something outside of the element of what you're used to doing. I know you're sitting there saying, well, I don't have time for that. Just make time, even if it's once a week. Hey, if I hang out with different people, then I may just mess around and get a different view on life. I purposely hang around with a different crowd because it helps me to reevaluate my situation. It helps me to re-examine my situation. And this allows you to make new friends. There's nothing wrong with that. Make new friends, new associates, new people that you deal with, and seek to understand the things that they deal with. And it'll help you with your focus on your life. Tip number 5, self-regulate your nervous system. We talked about mindful breathing earlier, sensory input, going outside. Stay grounded. Look, pay attention to those things. Your body needs it. Sitting there, just take 30 seconds. Breathe in and out. Breathe in for 5 seconds, out for 5 seconds. Look, let's try it out real quick. I want everybody to do it with me. Close your eyes, and I want you to breathe in for 5 seconds. I'm gonna count to 5, you bring in, and then I'm gonna hold it for a second, and then you breathe out, and I'm gonna count for 5 seconds. And we'll do it 2 times, okay? Here we go. 1, 2, 3, hold. 1, 2, 3, use release. We're gonna do it again. Breathe in. 1, 2, 3, hold, breathe out. 1, 2, 3. See what this allows you to do? It allows you to take a moment, take a breath. Let me go ahead and I'll also throw this one in there. Just start when you find yourself, all your anxiety or you get really frazzled, just start at 90 and count backwards. Just count it back down all the way and pause between each number. Take your time. If you mess up, it's okay. Start back over at 90 and start it again. By the time you get to 1, you'll see that you are more grounded, more settled. Okay? Allow yourself to feel what you feel when you feel it. I'm gonna say that again. Allow yourself to feel what you feel when you feel it. In that moment, know that it's okay. It's okay that you're dealing with the things that you're dealing with and you're seeing the things that you see. And our last tip is simply to breathe. Get plenty of sleep. It's recommended 6 to 8 hours. Make sure you're getting the rest. Make sure you're drinking enough water every day. Avoid overuse of alcohol or drugs during that time frame. Eat a well-balanced diet. Okay, look, I know we have a lot going on, but if you don't take care of you, how can you help others? How can we preach it to someone else? I often make this statement. I don't prescribe medication to other people I'm not willing to take myself. So I put a special emphasis on sleep, put a special emphasis on, making sure, hey, I'm eating well balanced, and I'm making sure I'm mindful if I'm socializing and what I'm consuming, what I put in my body to reduce stress. This is important. If you use these steps, it'll help you sustain. So I thank you all for joining us today. I'm now gonna open up the floor to any questions that you may have. I'll be glad to answer those. This is my contact information. If you have any questions, if there's any way that me or anyone with Stitches for Life can be of assistance to you, by all means, please let me know.
Hi, my name is Toni Bankston, and I am the director or the CEO of the Baton Rouge Children's Advocacy Center. I'm also a member of the Center for Mind Body Medicine Global Trauma Relief Team. With both of these organizations, I think there's a common thread, which is responding to trauma. The Baton Rouge Children's Advocacy Center, in case you're not familiar with that agency, what we do here is we respond to children and families. The children are ages 3 to 18. All of them have either experienced directly or witnessed violence through a violent crime that's happened in our community. And then for the last 15 years or so, when I'm not working with the Baton Rouge Children's Advocacy Center, I do some side work with the Center for Mind Body Medicine, who their job really is to respond to global trauma. And what we do there is we go to places where there's been what we call a community-wide or a population-wide trauma. That means to go into places like Haiti, where there's been an earthquake. The Center for Mind Body Medicine came to South Louisiana during the months after Katrina. I was responding to Katrina just after the hurricanes in the airport when it was turned into a field hospital. We've been here in South Louisiana working also on the Gulf Coast after the oil spill. And then other places in the United States where we have worked have been places like Sonoma County, where there was terrible wildfires. We worked in Las Vegas after the shooting there. We worked in Broward County after the school shooting there, along with Sandy Hook. And so our job is to go to places and respond to the community that has experienced trauma, but we're also there to help the people who are responding to those disasters. Oftentimes in communities where there have been disasters or a violent, significant event, people who are responding are also impacted by the trauma while they're responding. So it's a really unique kind of situation to be in. And it's also a unique set of skills and knowledge that goes with responding to people and helping the responders responding to the trauma in community. So this is work that I'm very passionate about. I was asked to come here today and share some knowledge or wisdom that I've picked up along the way from working with other providers across all kinds of different disciplines, everyone from law enforcement to firefighters to teachers to FEMA camp workers, volunteers, social workers, mental health folks. We work with everyone. And I was asked to share some of the principles that I've learned from that. But I think what I want to say most especially to you is that, you know, when I come to you today with this information, I'm coming to you also as a responder myself. I've had a couple of times where I've had kind of like that dark night of the soul where either I was in a situation, particularly the war zones that we've been in, where I was really scared and terrified because of a situation I was in. Or I've also been in situations where I was really pushing the point to burnout. And some of the things that I'm going to share with you today are things that I learned through my own training and through those experiences of implementing what I learned. They were life-giving for me. They were things that helped me to stay in this for the long haul. And they were things that allowed me to take care of myself while also responding to others, while also teaching others. And that's really key. So that sort of segues into my PowerPoint that I want to share with you, which I will right now. And this was actually a group of sisters that we worked with in Haiti who had been responding to the earthquake, which was a really valuable time in my life. So notice the title. The title says self-care is primary care. Back in the day, in older times, we used to think of self-care as being something that was more or less separate. It was that thing that we did after work, go to the gym, take a walk, go to those meditation classes, play golf. But it was the things that we did outside of work to take care of ourselves. The more modern way of looking at self-care, which is based on the science, it's based on the research, is that self-care, when you're working with people, particularly people who have had a lot of stress, either acute or chronic, or you're working with people who've experienced trauma, self-care needs to be something that is woven into your workday. It may be 1 or 2 minutes, it may be 5 minutes, it's whatever you have, but it's no longer something that you think of as separately. We teach people how to weave it in throughout the day. And in fact, the approaches that we use, and some of which I'll share with you today, are actually things that you can do while you're helping someone else. So we're going to do an exercise in a moment where I'm going to show you how this works. But the idea is, as you're working with people to help them calm down their own nervous system, you're also working with yourself simultaneously. And that allows you then to sort of empty your cup and really, well, actually to fill your cup and to really have more to work with when it comes to working with people. And speaking of emptying your cup, I always love to start with this slide because some of the approaches that you may hear me talk about, or some of the concepts you're going to hear me talk about today, are actually kind of a new paradigm shift. They really challenge the ways that we think of working in the past in a nonprofit setting or in a trauma responding setting. Used to be that, you know, we were kind of told that we needed to just kind of buck up and we needed to just toughen up and get strong and just keep on providing. The modern techniques now are really completely shifting that paradigm altogether. And that's because the statistics that we won't have time to go into today really indicate that across a discipline, there's so much risk associated with responding to people in trauma. So the suicide rates are higher, the burnout rates are higher. And what that suggests is that we're beyond the days of saying, oh, you just need to toughen up a little bit, or, you know, what I'm feeling is nothing compared to the people that I'm working with. We need to let those kind of things go. And that's what I mean by emptying your cup. You've really got to challenge some of those things that you think you know that can actually get in the way of learning what's new and what can actually be more helpful. So I invite everyone who's listening to this to really empty your cup, so to speak, to let go of those old ways of thinking and be open to some possible new approaches. So along those lines, before we get into a lot of concepts, I wanted us just to take a moment to actually practice what it feels like to really step back and pay attention to what's happening with us before we work with other folks. This tool that I'm going to teach you is probably our #1 favorite tool. We've taught it everywhere with every age group. And even if you do this for 3 minutes to 5 minutes during the day, you will see a huge benefit, especially if you do it over a long period of time. It's called soft belly breathing. And this picture here, if you want something to look at rather than closing your eyes, this picture was taken from the Gulf Coast. It was actually taken when we were working with folks during the oil spill that happened there. This community was rocked by the oil spill, devastated. Lives were turned upside down. And then a few months later, they were hit by a hurricane. So we were down there teaching these skills to folks. And I always think about them when I see this picture, because it was a really, really beautiful culture within to work. So just allow yourself to sit quietly. And again, if you feel comfortable doing so, just allow your eyes to close. And if you're not comfortable closing your eyes, you can sort of stare at this picture in front of you, or you can actually find a spot on the floor to gaze. And I want you to just notice for the next few moments your breath. Notice the rate of your breath. Notice the location of your breath. Is it high up in the chest, where much stress-related breathing happens? Or is it lower, more toward the belly, which is where we are breathing from when we are more relaxed? So just notice, not necessarily changing. On your next in-breath, I want you to intentionally go a little deeper with your breath and a little slower with your breathing. Breathing in through the nose and out through the mouth. Taking a few more breaths like that. And as you breathe in and out, you might notice that your belly is rising and falling. That's a good sign, because that means you're doing deep diaphragmatic breathing. We call it soft belly breathing. And you might even say to yourself as you breathe in the word soft and belly as you breathe out. Soft belly breathing as the belly is relaxed, so then the rest of the muscles in the body become relaxed as well. When we breathe this way, we're actually activating the vagus nerve that lines up near the belly in the back. And that vagus nerve is sending a signal to the amygdala, sending a signal to our brain that there's no threat and that we can calm down. So taking a few more breaths in and out. And again, this very simple technique is very powerful. Indeed, it is the antidote to the fight or flight mechanism that gets activated when we are in stressful circumstances or when we're responding to people in stressful circumstances. So just allowing yourself to have those slow, deep breaths. And when you're ready, and as you're ready, bringing your awareness back to this conversation, allowing your eyes to open and just noticing how you're feeling. Noticing that you may be a little bit more clear. Noticing you may feel a little calmer. Sometimes people will say they feel more connected to others when they engage in this breathing regularly. So as we move forward, I want to just offer you some guiding principles that I like to think about when I'm working in trauma-impacted communities. These are things that are helpful to anyone who is responding in communities, as many of you are right now. So this little picture of Mighty Mouse, this is an old school cartoon. Here's Mighty Mouse saying his mantra, "Here I come to save the day." So a lot of times when we come into this work, whether we are volunteers, or we are mental health workers or first responders, we want to save people. We want to save lives. And that is very noble, and that's a wonderful mission to have. But oftentimes there is a burden that comes from a mindset that says, in order for this person to be saved, I have to be the one always doing something. And what we try to do is to really help people understand that they have tools themselves. We can teach people tools to help them heal themselves and also to save themselves. There are many things that are life-saving that we must do, of course, but there's also a lot of things that people can do in communities to help themselves. And in fact, when we go into communities, the mindset is, I'm not here to fix people. This community probably knows better and has a wisdom itself about what it really needs and how it wants to, what path it wants to take to recovery. So rather than there being, we're here to save the day and tell you what you need to do, kind of that one-up stance, we need to think of ourselves as being in partnership with the community, partnership with people. Because when we're able to help people see themselves as partners and collaborative, it's sort of taken away some of that heavy burden of, I have to do everything. I have to fix everyone. No, we're not here to really fix anyone. We're here to help people learn tools that they can use to help themselves, even as we're connecting them with the resources. This slide right here that says, make sure the elevator's there before you step in, is really just calling attention to the fact that many of us who got into the helping profession or really became volunteers because we wanted to help, we often did not really realize what we were getting into. There's a lot of people who come here to the Children's Advocacy Center, and when they interview, and sometimes even when they're hired, they want to be here to help children. They really want to help children who've been abused. But then when they begin to be that person day after day after day that's listening to terrible stories, what they find out is that they don't have the capacity that they thought they had to do that. It's really something that you can only know from living through it. And so many people, have one idea about how they're going to work in a helping profession, and then they sort of find out something different when they're in it. And that's okay. It's not about judgment. It's just that this is really, really difficult work. We're in it with people when they're having the most difficult day of their life. And whether we think so or not, and no matter how strong we are, that impacts us. We see things with our eyes, we hear things with our ears, and no matter how strong we are, and whether we sense it or not, that is having an impact on our nervous system, which means that we have to do something to mitigate that. Also, many people who went to school to work in this work, like doctors or law enforcement officers or firefighters, until recent years, self-care and secondary stress, that was not really taught in schools. So many of us come to this helping profession without the tools that we need to really take the best care of ourselves that we can. And what we know when we talk about trauma, we can talk about definitions, we can talk about interventions, but if we're truly going to be trauma informed as an individual provider or as an organization, we really have to come to terms with the fact that exposure to trauma, or even exposure to populations that are in toxic stress long after the big, huge traumatic event is over, that has kind of a contagious effect. It's a little bit contagious. In fact, you'll notice after you've been working with people for a while that even if you weren't a part of the trauma picture that you're responding to, you'll begin to have some of those similar symptoms. And so trauma can be contagious. And so we have to protect ourselves and our colleagues. And, I'm thinking back to the work that I did in Haiti. Before I went to Haiti, I took a pill for malaria. And so, there are things that we can do to offset things like tuberculosis or malaria. But with vicarious trauma and secondary stress, there is no pill we can take. There is no shot that we can take. However, there are two things that we can learn, two things that we can have that actually they are really kind of the antidote, or they do offset the toxic effects of secondary stress. The first one is self-awareness. So by being self-aware, which is really just kind of checking in with yourself throughout the day or as a team, you're actually preventing the onset of secondary stress and secondary trauma. And then self-care is what you utilize to actually offset the causes of the secondary stress. So when you're aware, if you're doing your check-in and you're checking in with yourself and you're having that awareness, you notice your heart rate is a little bit elevated. You're very upset because maybe you're trying to get a resource to a client and you can't get that resource, and you notice you're angry and irritated. And through checking in with yourself, you notice that heart rate going, pretty quickly and pretty rapidly. Well, that's when you employ your self-care. So that's when you simply bring yourself back to your breath. Sometimes self-care is having a buddy. Sometimes self-care is, I just listened to a forensic interview. It was of a child who witnessed the murder of his mother, actually happened recently. And I need to talk about that. I need to talk about what that brought up for me, because when I was in the moment with the child, I had my shield up and I was there for the child. But now that the child is gone, I really need to talk about what that brought up for me. So self-care can be a lot of different things that we're going to talk about. And then, you hear a lot of terms: secondary stress, vicarious trauma, and there are some subtle differences to those terms. We won't get into that today because we don't have time, but I will be talking to you mainly from the standpoint of vicarious trauma, which is basically having vicarious, you're having an experience or symptoms through working with someone else's trauma. So it's their trauma, but their trauma is having an impact on you. And that's what vicarious trauma is. And then, I have a picture of paper clips here, because the thing about stress is, everyone has stress every day. But long-term stress, cumulative stress, it's like taking a paper clip that is really strong and you continue to bend it back and forth and back and forth. And what ultimately happens is the paper clip breaks, right? That's because over time and having a stress response, stress has the capacity to either weaken us or to make us stronger. But there are things that we know that increase the likelihood that we're going to bounce back, or actually decrease the likelihood that we're going to bounce back and that we're actually going to become worse or weaker. I included a little slide here of the stress response because we know, most people know, I'm sure most people reading this or hearing me right now already are familiar with the fight, flight, or freeze response. And that's what our clients have had activated for many months if they've gone through hurricanes. That switch doesn't get flipped off, because once the switch gets flipped to being threatened and in a state of emergency, unlike animals since they have the same built-in kind of 911 system that we do, and once the threat is over, they tend to go back playing with their young, feeding, and so forth. Human beings, we tend to hang on to it. We tend to hang on to that threat, sometimes for years, as long as we can remember something. Remember when the hurricane hit, remember when the bad man came into the house, remember the earthquake. Our minds respond exactly the same to that image. So that system of fight, flight, or freeze that actually is meant to protect us and survive during a real emergency begins to work against us. So as you're responding to people who may still be in this ongoing chronic state of fight, flight, or freeze, it's important to remember that you're responding to people who are having a nervous system reaction. This is not just about making people change their thoughts. It's not just about helping people to manage emotions or talk it out. It's really about being able to give people techniques that allow the nervous system to come back into stabilization. And that's what the mind-body medicine techniques do. And then the other piece about this is, just as the clients you respond to are having a nervous system reaction, we know that vicariously your fight or flight can get activated as well. So let me give you an example. You may be out in the field responding to hurricane disaster relief. And you may have a person that just becomes really enraged and angry, and they're in your face and they're yelling, and they may be mad at 3 or 4 different entities or people, but you're kind of getting all of it. And you'll notice that when that person is spouting out in all the anger, that your heart rate goes up and you start feeling your fist tighten. That's because the trauma of other folks or the threat of other folks, again, it can have this contagious effect where our nervous systems get activated to this fight, flight, freeze mechanism. And in doing so, we have to be aware of it first, and then we have to do something secondarily to calm it down. Cumulative stress is another matter. Cumulative stress is really people that we've worked with that have been in stress for many, many months, longer than just that initial event. I feel for people who work hurricane disasters, because I remember in working with Katrina for 3 years, by year 3, we still had people whose lives were turned upside down that had not resettled into their old place of living. So this is a really chronic, long-term effect of stress, which can be just as debilitating. And then the other thing that does for people who are responding to populations of cumulative stress, you're more likely to be vulnerable to burnout because you've been at it for a long time. There is a fatigue that sets in. And unfortunately, sometimes we don't really become aware that we're having that impact on us until it's already too late. So that's why that self-awareness and really employing those self-care techniques is really critical. And when you think about, these are the things that the American Psychiatric Association says creates a traumatic event. This is what makes up a traumatic event. And as you look here, you can see that this applies to many things. And the important thing about that is not only does it apply to many things, but it also tells us that the majority of the population everywhere at some point in their life is going to have trauma. And what that means is that this is no longer something just for doctors to learn about. It's no longer just something for social workers to learn about. Everyone from the cafeteria worker to the truck driver to the camp worker really needs to have the knowledge of understanding trauma and how to respond to it. How to respond to it in a way that supports healing, but also being equally focused on the impact on the self, because secondary stress and trauma is a real thing. And then I just have to mention this because after all, we are in the middle of a global pandemic. And so we're already beginning to talk about the COVID pandemic is yet another trauma. For our kiddos, it is another adverse childhood experience because it's happened really to the whole population. And this is a nice graph that I created, but the main thing that I wanted to point out to you is here at the bottom. If you look at this graph of work-related trauma exposure and vicarious trauma, you see that sometimes it has the capacity to change people's worldview. In fact, spirituality is greatly impacted by trauma. It can actually strengthen people's faith in a higher power, but it can also bring a lot of things into question. One of the sort of inside jokes that we have here on our team of 16 people is when you do childhood trauma work for a while, you start questioning everyone. When you go to bring your child to sit on Santa Claus's lap at Christmas time, you're like, has that Santa Claus had a background check? Because your worldview begins to change when you're dealing with so much negativity and so much trauma. So that's something that's pretty common. And then over here on the right, the opposite is true as well. If you see down at the bottom under positive, you see a fancy term there called vicarious resilience. Well, we talk a lot about vicarious trauma and secondary trauma. We don't talk a lot about vicarious resilience. And what I love about that is that it really captures that feeling that you get from doing this work and feeling so incredibly fulfilled. Because when you work with people on the most difficult day of their life, it is truly rewarding. And when you see people healing or you see people making progress, it's actually very inspiring to you. So it's actually the opposite effect of working with people and getting that vicarious trauma, that there is there is a way when we are really keeping those other negative impacts in check, that our work can be extremely fulfilling and very worthwhile. And we can walk away from work with people who are going through terrible times very inspired. I'll just give you one quick example of this. When I was working in the Middle East, I went to Gaza a couple of times. The first day there was 20 days. And at the same time I was in Gaza, I was also in the process of developing programs for schools in Baton Rouge, in the urban part of Baton Rouge, where the need was greatest, the drugs were highest, the violence rate were the highest in these particular zip codes. And I was in the middle of developing programs, and then I went to go to this trip, and these were folks who are dealing with shelling every day. I mean, we woke up to shelling while we were there. And there was a bomb there too. And yet I saw people doing the most amazing, courageous things. And they were bringing these incredible programs to their schools. And that was truly, once I got past the trip and the stress of it, I was really sitting with a lot of inspiration that if people who are in a war zone working with children, if children who are waking up to shelling every day can learn tools and feel some relief from that, then why can't I bring this to Baton Rouge? And that really kind of gave me a new energy to come back to my own community. So that's an example of vicarious resilience and being inspired by the work that you do. And just real quickly, I won't read through all of these, but these are just, look at all the various ways that vicarious trauma can affect you. It can affect you in your body, affect you in your mind. It affects behavior. Sometimes on our team, we'll notice when people have been doing a lot of forensic interviews that we get more snippy and kind of irritated with each other. Well, that can be from the stress of the trauma that we're addressing. So the relationships can change. When we work with our military, one of the things we really see a lot is that the relationship with the spouse changes. And so family relationships are changed. With the pandemic, we've seen a huge increase in domestic violence because, again, it's that fight or flight mechanism and people kind of turning on each other who they would normally turn to for support. And these are ways that it shows up professionally. So you'll see people that miss work a lot or seem kind of amotivated when they used to be really motivated as an employee. You see changes in morale. So we said that self-care was the piece that needed to be woven throughout the day. And here's a nice little definition of self-care. It says it's what people do for themselves to establish and maintain health and to prevent and deal with illness. So when we work with individuals or we work with responders, what we're doing is helping them to develop a toolkit. Soft belly breathing that we did at the beginning might be one typical tool, but there are many others. There's walking meditation, there is yoga, there are tons of tools, and we work with people to establish the one that's just right for them. And it's not just about the individual though, it's also about the organization. So organizations have an ethical responsibility to make self-care of employees a priority, particularly when it's an organization that's responding to trauma. Here at our CAC, I'll talk about this in a moment, but we check in every week with each other. We have a circle, we do some meditation, and then each person has a chance to talk in turn about how they're doing in the work. It's not necessarily about spilling guts or bringing in your personal stuff, unless people want to, and they're certainly free and it's a safe space for that. But it's really acknowledging with your team where you are in the work. And just knowing that about other people can make the work together so much better, because we can be aware when someone on our team is struggling. And again, this is something that I said earlier. This is doing soft belly breathing with kids on the Gulf Coast. But self-care and care of others is not mutually exclusive. So it's something that we begin to teach people that you're doing it all throughout the day. You can close the door in your office after a tough meeting, come in, take a few breaths, or we teach something called shaking and movement, or shaking and dancing. And, that's really helpful because with trauma and stress, a lot of that is held in the body. So being able to move the body, taking a walk, shaking it off, kind of like you see a dog do when they come out of a scary situation. You'll see them just kind of shake their body. So we can do that as humans. That's a way of shaking off stress. And you can just close your door and shake it all off, turn on some music, do a little bit of movement, and you'd be astounded at the difference that that makes. That can be part of your toolkit too. So again, self-care is it's not a luxury. It's actually at the heart of caring for other people. And in fact, it's actually primary care. It's fundamental. You cannot do for other people what you don't have. You cannot feed people from an empty bucket, so to speak. So it really needs to be essential and primary. There's an exercise that we won't do right now, but it's just one that I'll mention. You can also do this if you happen to be a leader of a team. You can get out paper. So you might be hearing this, you might be kind of reading this into what I'm telling you, but a big part of working through secondary stress and trauma involves expression, whether it's expression of emotion, thoughts, body movements. In this particular exercise, we're using art to help people work through vicarious trauma. So, for example, we give our team members three papers, and on the first page, they're going to draw a picture of themselves with their biggest work challenge. So allow an image to come that represents you with your biggest work challenge. Let them draw that. Second picture, draw a picture that represents you with your biggest work challenge solved. So allow an image to come of your biggest work challenge resolved. What does that look like for you? And let them put that on paper. And then the last drawing is, how are you going to get there? So the second picture was your biggest work challenge solved. The third picture is, how are you going to get to number 2? What would you need from yourself? What would you need from the organization to get to that resolution, to get to that solution? And then allowing that to unfold on paper. And then people share it. And it's really interesting because when you do this on Teams, you'll see all the similar themes that are unfolding right in front of you through the art. And we also find that when you use the right brain, people tap into solutions that they wouldn't think of just by using their left brain, just by really thinking cognitively about this. So it's kind of using a deeper part of the brain that has a certain kind of wisdom that unfolds on the paper. So it's very, very helpful. And I kind of already said this, that it's not just about an individual self-care. It's also about, the need for organizations to provide opportunities to train workers and to really impact secondary stress. And here are some of the ways that you can do it organizationally. We call these some strategies in action. And I won't read through all of these, but notice like debriefing staff. So actually making time for people to sit around and have camaraderie at the end of the day and talk about things. So one of the agencies that is really, there is an organization that I am so fond of. I follow them regularly. They've actually collaborated with us for donations to the children at our organization, the Cajun Navy. So the Cajun Navy, one of the things that I noticed that they do, there's a lot of camaraderie. They post on Facebook, and as they post, you have a sense of their very difficult work. But you also have a sense of their playfulness. You have a sense of them coming together at the end of a day or a long week and to be able to laugh and do all kinds of things to have fun. And that's really what I'm talking about here, is really, really having that debriefing and paying attention to how people are feeling, having supportive leadership, hosting events, encouraging staff and wellness practices right into your policies and procedures. So we recently did that here. We actually added to our PTO for our employees to make sure they had adequate time to have time away from responding to trauma. And then we also incorporated every quarter, we have one full day to get away from the building and everybody do something social together, whether it's bowling or golf or we did, it's the artwork that you do as a team at one of those painting places. I think the places we went to was painting in Pinot, but you get the point. Everyone is doing something together, team building, not related to trauma. And that's so, so helpful. Peer support, can't say enough about it. The Army had it right. The Army developed what they called the buddy system. And it was really kind of assigning somebody on the team that was your person who always had your back. Well, all teams need this. All teams need to really have an idea of who are the people or a person who has their back during difficult times. And those peers can then model conflict resolution, teach effective communication skills. It's that person that you know has got your back. As a leader here, you know, what I find is it's a little tricky because as a leader, you know, I want to be friends with everyone here, and I think I have positive relationships with everyone. But as a leader, I'm really holding the space for the team, as we say. But there are people in my leadership team where I can close the door and be completely vulnerable. And so everyone, even people at the top, really need to have that relationship. So when you think about self-care, you think about vicarious resilience. It's really kind of like, I love the image of a well, because it's really looking at whether that well is full, half empty, or empty. And again, you can't give to people from an empty well. So it's always monitoring where's the level of your well, and are you paying attention to it? Are you preserving that deep well so that you have enough to give others and that you have enough left for your family and for yourself? And these are some ways that you can do that. I'll list them really quickly because of time. Again, it's that awareness. That's key, because if you have to be aware of something in order to make it better. And finding a go-to place that brings you back to homeostasis. Think about how many times, I know I did it today at least twice because we're having technical issues, but you know, think of how many times you have to unplug your cell phone or turn off your cell phone and turn it back on, or unplug your computer. You go to your IT people and say, you know, I'm really aggravated with this computer. And they say, have you unplugged it? Have you tried unplugging it? Well, human beings are like that too. There's sometimes the only thing that's going to help us to be able to preserve that deep well is simply by completely unplugging from our work, getting distance, complete distance, sometimes for an extended period, so that when we turn back on, we're back and ready to go. It's a similar idea. And we talked about some of these techniques already. And these are some other ways. So this is one that when I teach it to first responders, I kind of get a little look, like when I do this with firefighters and law enforcement office. But we say, let the tears flow. That's actually, I think, from the poet Rumi. Tears are the window washer of the soul. And this is really true. In Western cultures, we've sort of learned how to turn that off, turn off tears, don't let tears come. When I work with clients who've been through trauma, they have a lot of fears about crying. Some of them, if they're male, they'll say, you know, I have to be strong. I'm the boy and I was told I need to man up and be strong. Some women don't want to cry because when they do, they say, I'm afraid I'll never stop crying if I start. But we got to understand that this is in our DNA. Two things. It's in our DNA to connect with other people when we're in the midst of trauma, just like we have that fight, freeze, flight response. We also have a need. It's actually called tending and befriending. We have a DNA need to connect with each other when something bad has happened. Notice that with flooding, you know, everybody's getting together and talking about, you know, I remember I grew up with floods. My house flooded 3 times. And when I was little, I used to hear people say that word crest all the time. And I'd say, Daddy, what is crest? Well, we had neighbors that we hardly ever talked to until there was a disaster. And it's in our DNA to connect with other people. It's also in our DNA to express emotion through tears. And in that way, tears are the window washer of the soul, that once you express the emotion, then you can relax. It's a natural cycle for how we deal with intense feelings. We teach mindfulness and awareness. We're actually having a big community-wide training in Baton Rouge in June. There are a lot of scholarship slots that are open. If you're interested in that, you can reach out to me at Toni, T-O-N-I, at Baton Rouge, spelled out, CAC.org. This is a training that it's a 4-day training twice, an initial training in advance, and it trains people in how to do this work with other people, mind-body medicine, and also how to tend to themselves. And our training here in Baton Rouge is going to wound up for many people with a certification, and we'll actually have a leadership team here. So if you're interested in learning more about that and having a deeper learning experience, you can certainly email me and I'll let you know how to get connected. This is just a little graphic to show you what some of those tools of mind-body medicine I've been talking about are. These are not all of them, but we even have one, if you notice, on nutrition. You know, what kind of foods do we eat and avoid during times of stress to support a stress response? And we have one on spirituality. There's drawing, journaling, movement. So this is the basic toolkit. And I just want to thank you very much for your time today. And I hope that this has been beneficial for you. If you have any questions, feel free to reach out to me. Our phone number here, by the way, at the Baton Rouge Children's Advocacy Center is 225-343-1984. And if you are interested in the work of the Center for Mind-Body Medicine, you can see that website. It's www.cmbm.org. And that will show you, there are a lot of videos and a lot of audio recordings that you can practice some of the skills and see how you like it. And you can also see some of the work that's been done in other communities impacted by disaster. So I wish you well, and I hope that you will continue to pay attention to yourself as you take care of other people. It's so important.
United States Senator Bill Cassidy here. It's an honor to speak to you. We know this past year has been so tough. Pandemics, hurricanes, you name it. And the combined effects of pandemics and hurricanes, it has been a trying experience, particularly for Southwest Louisiana. But your resiliency has inspired us all. Your tireless work and dedication over the past year has given some people for others to look at and say, wow, look how good they're doing. I can do just as well. You have shouldered not just the responsibility of saving lives amidst COVID and the hurricane, but also, if you will, the privilege of being an example of overcoming. And for that, we're all forever indebted. Thank you.
Is that it?
Sign and say, come back in 30. Good.
All righty. Hello, everyone. This is Tanya McGee. Dr. Blunt, I'm going to ask you to put yourself on mute really quickly. I believe Stephanie is going to get our video going. Stephanie, it says that we cannot start our video because you have stopped it. So I don't know if you want to work on that really quick while we go ahead and get started. All right, guys. While we're working to get the video up and going, I just wanted to take a minute to go over a handful of questions that we've received. Just to let you know, as part of this seminar, we wanted to make sure that we not only had our fantastic presenters available for their presentation, but also for this Q&A. So Amanda actually is going to be helping us get our video open going. So that's okay right now, even if we don't have the video, we have all of our presenters here. And you should, Let's see. Oh, look, there I am. Okay, great. Now, we are going to jump into our Q&A session. And we are going to try to keep it brief because we are very mindful of your time. We know we're already past the noon hour, but there are a couple of questions that I think are really important and hearing our panelists' response to those. So I ask if everybody can just hang on with us for about another 10 to 15 minutes, if that. We're going to zip through these questions really quickly. Now, first off, a couple of announcements that we saw popped up in the chat. This is being recorded and it will be posted on Mental Health Association of Baton Rouge's website. So folks will be able to see it if you weren't able to stay for the whole thing or if you want to share this with others. In addition, the PowerPoints are not going to be sent out, but you will have the recorded video. There was a question about Mental Health Day at the Capitol this year. Because of COVID, Mental Health Day is going to be held virtually this year, and that's going to be on May the 4th. All righty, let us jump into some questions. So first, we have a question for Sherrod Crespo. You talked in your presentation about helping identify when people are in crisis state and sometimes recognizing that in other people. One of the questions is when you recognize that a coworker or a family member is in a crisis state, but they don't see it themselves, what are some suggestions that you have about approaching them and letting them know what you're seeing? And if you could unmute yourself really quickly to answer that question, that'd be great.
Sure. That is a great question, really. And I think that the easiest way to go about it is to not kind of be so clinical or labeling when we're speaking with our friends and family, but to more just kind of casually, and I know this is what we do a lot on the phone lines, just say, hey, let's talk. Share what's going on with you so that then kind of subliminally that person will start sharing what's going on with them and just having a conversation, have a cup of coffee, glass of wine, whatever time of day it is, and have a conversation with someone and just give them that chance to vent. Someone's just starting to be able to vent and verbally speak out what's going on with them is the first step towards them de-escalating. So I think really just opening the dialogue, letting people know you're not perfect either. You're stressed, you're worried, you're sad, whatever's going on, and giving them that chance to speak without trying to say, I think you're in crisis, or I'm worried about you, because that can put people on the defensive, especially if they're working really hard. To just say, oh, can we sit and talk? I need to talk. I hope you can talk. Like, let's chat, I think is a great way to start that going. And then as you're talking, you can kind of use those skills while they're just telling their story, being like, man, you've got so much going on at work. It sounds like you're feeling anxious, and utilizing those skills that way, just having a conversation.
I think that's perfect. Thank you so much. Yes. And in listening to all of your stuff, I know you just said have coffee or drink some wine, and everybody's talking about alcohol consumption. I have to say, in drinking that glass of wine, sometimes I think it would make me feel better in listening to everybody to go outside, like Dr. Blunt said, in my bare feet, in the grass while I drink my wine, and like what Tony stated, while dancing, I think is what we're going to end up doing. Thank you, Sherrod. Appreciate that. And thank you so much for your presentation. Dr. Blunt, we have a couple of questions for you. You talked a little bit in your presentation about not making life decisions while you're in your burnout phase. But what if someone is forced to have to make a decision while they're in that burnout phase? And here's an example. As you know, we had 2 hurricanes that affected Southwest Louisiana, and we already were experiencing burnout from COVID. But folks have been having to make some pretty significant life decisions because of their homes being destroyed and their kids unable to go to school while they're in that burnout phase. So can you talk for a couple of minutes about when we do have to make those life decisions while we're active in that phase? What are some suggestions?
Okay, I would love to. When you're in that state, that is an emotional state. And when you're in an emotional state, it's an irrational, you're being irrational during that time frame. And I'm sorry, I got feedback there for a moment.
That's okay. I think I have everybody muted. Go ahead.
Okay, so, uh-oh, I got muted. All right, there we go. When you're in that emotional state, you're going to have to avoid making those decisions. And in order to make those decisions, my recommendation would be to speak to someone else who's outside of your normal circle. That would be my recommendation one. It'll allow you to have a different point of view. Yes. And this will open up other opportunities for you at the same time. One, to give you more options.
That's a great answer. Thank you. So another question that we had for you, Dr. Blunt, was you are very energetic. We could just tell by your presentation how energetic you are. For those folks who might not have as much energy, you were talking about, digging deep into yourself to try to find that energy. How would you recommend that folks can like tap into some of that inner energy while they're during that burnout phase?
I'm sorry, for some reason, I must have had some feedback or something. Repeat your question.
So the question was that it was stated that you're a very energetic person. And some people might have pretty low energy, especially whenever they're going through a burnout phase. So what suggestions would you have about ways that people can like tap into their inner energy?
One is taking, what do they enjoy doing? Searching themselves. What do you enjoy doing? How do you, when you're not having to work, how do you relax? How do you take those moments for yourselves? And by doing so, that'll allow.
Really doing some introspection and to see what exactly excites you and what gets you energetic.
That's correct. Additionally, being involved in other activities, volunteering places, stepping outside of their norm. I believe in shifting your focus.
Okay, that's great. Thank you. One more question for you, Dr. Blunt. You as a mental health professional, myself as a mental health professional, we often see that people in our field as mental health professionals don't often seek mental health help. So counselors don't access counseling. We have an employee assistance program that we have through our organization to where we make counseling available to our staff. But what we find is that those that are in the profession of doing counseling themselves don't often seek that help. How would you recommend that we would engage folks that are in this field to really seek out that help?
Honestly, I believe it should be mandatory that every counselor needs a counselor. I have one. In fact, I have more than one. And I've been in the field for some years now because you need that release.
Absolutely.
My recommendation as far as getting people more engaged in that is that they bounce off of other people. Visa.
So I think kind of what Sherrod was talking about in not approaching it as a counseling type situation, but maybe just engaging them in conversation and bouncing things off of each other if you know that they're not going and seeking that counseling on their own.
That's right. Contacting other medical professionals and creating a network, staying in close contact with them. And I do what's called staff casing with several other professionals that I am close to. So at the same time we talk about different cases we have, we also check on each other. Hey, what are you doing? What do you have going on? And we kind of keep each other on a path so that if we notice that some person, all they're doing is working, all they consume is work. Okay, now we need to make sure it's like the buddy system that the last presenter talked about. We created our own little buddy system to make sure everybody is they're staying and keeping everything together.
Thank you so much for that. Okay, very much enjoyed your presentation as well, Dr. Blunt. We're going to move on to Tony Baxton. Tony, we have a question for you. So you talked a lot about working with the people while they were in the trauma and bringing yourself down to the level as a collaborator, not as a superhero coming in. I believe we can all in Southwest Louisiana attest to this because we were victims of the trauma of the hurricanes ourselves. So coming in and helping those people that were affected by the hurricanes, we were doing that while we had damage to our own homes and loss of our own property. And so I'm really curious to know about, how does working in a natural disaster differ from working in other trauma?
Thank you for your question. Can you hear me okay?
We can.
Okay, great. So I should step back and say that in many ways, regardless of what kind of disaster or community-wide trauma that you're responding to, many things are actually really similar. And especially when you think about the nervous system's response and our built-in protection mechanism, that's going to be really similar regardless of what threat you're facing, whether it's a natural disaster or war or any other kind of trauma, right? What I have found though in working both kinds of disasters is qualitatively people with disasters that are more created because of human beings. There's another layer that people are dealing with that has to do with anger, that has to do with betrayal and rage sometimes at the perpetrator of that disaster. I think back to our work at Stoneman Douglas High School. You know, the perpetrator of that quote unquote disaster was a young adult male who went in and shot everybody. So there was a lot of anger and resentment and rage that had to be worked through. With disasters, you know, this is sort of an act of God, so to speak. And so there is, you know, with natural disasters, often what happens is that there's actually can be a positive benefit of we're all in this together. We're all impacted by this sort of act of God, and let's come together and help each other, even though, of course, obviously there's devastated loss. The Katrina disaster actually had a little bit of both because we had a hurricane disaster that was, you know, an unprecedented hurricane, act of God, so to speak. But then there was another layer of the levees failing. So actually, when we responded to victims there, you know, we had both things going on at the same time. In terms of being with people, so the term that comes up for me is this term co-regulation that, and I think other folks have already spoken to this. When you're impacted yourself and you're working with other people, in the past, what we've been taught is we've got to buck up and pull our boots up by our bootstraps. What we know now, though, is actually there is value in sharing the trauma with another person. So even though your home has been affected, when you sit in that vulnerability with another person, and it's not always about having the right words or, you know, it's not really about that. It's really about just being present authentically, even if that means revealing tears or pain. I'm in this with you too. I'm a real person. That actually creates a very safe space for people to be able to do their work. And the other thing is it's not always advised to allow people to vent. Venting is sometimes what people need to do, yes. There are also times when that's ill-advised, that people just need a space to have quiet, or they may need to move their body. And it's important to remember that there's kind of no one way of responding. But first and foremost is being yourself, being authentic, and being vulnerable, which is sometimes hard because we want to be the superhero. But we know now that being vulnerable really gets you much further in responding to trauma than trying to put on a brave face, so to speak.
Thank you for that. Definitely enjoyed your presentation, and especially a lot of your real life experiences that you had across the country. Thank you for all of the work that you've done. So we have another question from one of our participants, and this was open to anyone. So if any one of our panelists want to jump in with this question. The question is asking about brain fog. So there's discussion in the media about, when you go through traumatic events or long-term traumatic events, especially like what COVID has proved, and then in Southwest Louisiana, COVID coupled with the hurricanes, that you kind of go and you're living in this fog to where sometimes you're not remembering things, you're not really able to focus on some of just the day-to-day. Our participant asked if there's any exercises or things that you could do to kind of help get you back into to this fog. Jeremy has raised his hand. Dr. Blunt is ready to answer this question. Go ahead, Dr. Blunt.
Oh, yes, just real quickly. One is reestablishing a routine. What kind of routine? Either one that they have before COVID, I know it's been a while, but also creating a new routine of things that essentially they need to do on a day-to-day basis. That will help kind of clear up the fog. It's just like, ironically, they call it a brain fog. Imagine driving down the road in a fog. There are certain things. One, what are you familiar with based off of the area that you're in? Two, pay attention to the lines in the ground, those things on the side of the road, the lines that help you to stay on track. In that same essence, you can use those same things in reality for a brain fog. Okay, what things do I know I'm familiar with? What things am I used to doing? And let me focus on those first, so that I know I can establish a routine. And the more you do the things that you're consistently used to, you'll see that that fog eventually will start to clear.
That is an amazing analogy with the fog and driving down the road and looking for those lines. Thank you so much, Dr. Blunt. We are approaching the 12:30 mark, and we don't have, I just scanned through and we don't have any additional questions in the chat. So we're going to go ahead and wrap it up today. And I just want to say we had close to 90 participants in the session today, and we have lots more that plan on watching the recorded session. So a big thank you for our partners and for our presenters who were able to share with us today. And another huge thank you for all of you who joined us today in taking actually we're going on 2 hours today for yourself. We hope that you got a lot out of the presentation, and we hope that you have a great rest of your week. Thanks, everyone.